5 hidden signs of a heart attack hours before it occurs. This article is based on the 40 years of clinical experience and peer-reviewed research of Dr. Ford Brewer, a preventive medicine specialist and former head of the prevention program at Johns Hopkins University. A heart attack does not always strike without warning. In many cases, the body sends subtle signals several hours before the event occurs. 1. Sudden dizziness and loss of balance. When a blocked artery or an unstable heart rhythm causes cardiac output to drop, the brain is deprived of the oxygen-rich blood it demands, a condition known as reduced cerebral perfusion. The sign: feeling off balance, disoriented, or as if your head is floating, particularly when standing up from a chair or rolling out of bed. The statistics: according to a study published in Neurology, up to 10% of people experiencing a heart attack report dizziness as one of their very first symptoms. This is often mistaken for low blood sugar or vertigo and is dangerously ignored. 2. Cold sweats and clammy skin. If you are sitting still and suddenly break out in a cold, drenching sweat, your body has likely hit its internal panic button. The mechanism: when the heart struggles, the sympathetic nervous system triggers a surge of adrenaline and norepinephrine. These hormones tighten blood vessels to shunt blood toward vital organs, causing the skin to become cold, pale, and clammy. The statistics: the Sweats study, which looked at over 10,800 patients, found that nearly 91% of those with a complete arterial blockage experienced a cold sweat. This symptom often occurs in isolation, without any chest pain. 3. Persistent stomach ache and indigestion. The inferior, underside wall of the heart sits directly above the stomach. When this area loses oxygen, it irritates nearby nerves, specifically the vagus nerve, which connects the brain, heart, and gut. The sign: a heavy, sour stomach, belching, nausea, or a queasy feeling that will not go away. Many patients attempt to treat this with antacids, believing it is simply acid reflux or a reaction to a heavy meal. The statistics: evidence shows that up to 26% of heart attacks present first as a stomach ache. This presentation is most common in women, diabetics, and the elderly. 4. Fainting or seizure-like episodes. This is one of the most critical warning shots the body can fire. When the heart flips into a dangerous rhythm, such as VTAC or VFIB, blood flow to the brain drops to nearly zero instantly. The mechanism: the brain can only survive a few seconds without oxygen. When flow stops, the person loses consciousness, and the muscles may jerk or twitch, making the event look like a seizure, when it is actually a cardiac emergency. The risk: a Danish registry study found that 19% of young people who suffered sudden cardiac arrest had fainted at least once previously. Fainting without a clear cause, like dehydration, is a 911 emergency. 5. A sense of impending doom or sudden anxiety. Long before the conscious mind recognizes a physical problem, the brain's emotional center, the limbic system, picks up on cardiac distress. The sign: an overwhelming, deep-seated feeling that something is about to go terribly wrong, or an unexplained fear of death. The statistics: research shows that 35% of women and 20% of men reported a sense of impending doom during the early stages of a heart attack, often before chest pain or shortness of breath ever began. True prevention: test, don't guess. Traditional cholesterol panels often fail to identify the root causes of cardiovascular events. For true prevention, one must look deeper into vascular inflammation, the primary driver that makes arterial plaques unstable and prone to rupture. Early insulin resistance, a metabolic breakdown that damages arteries for years before a formal diagnosis of diabetes. Root cause analysis, moving beyond plumbing to understand the biological markers of arterial health. Sources of information: Neurology Journal. Research on the correlation between dizziness and early cardiac symptoms. The Sweats study. Analysis of warning signs in over 10,800 heart attack patients. Danish registry study. Data regarding the link between fainting, syncope, and sudden cardiac arrest. Clinical findings: Dr. Ford Brewer, preventive medicine expert and former Johns Hopkins faculty member. American Heart Association, AHA, Guidelines on Atypical Symptoms and Metabolic Triggers of Heart Disease.